Hey guys, hi, welcome back to Unacademy. This channel is Unacademy Future Doctors, and I'm your educator for biochemistry, Dr. Shivangi Shukla. I welcome all of you to this session of MCQ based discussion. Let me just check if the live stream has started or not. Let me just check if I'm visible and audible to everyone, and then we can continue. Okay. So we have been discussing MCQs, and yeah, I think the stream is going on proper. Am I clearly audible to everyone? Do let me know if my voice is clear. Okay, so this is the 7th session in the league of MCQ based discussion. Here, what we do is we discuss MCQs, and then I give you questions that are MCQs, and you have to answer in the comment section with 2 minutes of each question. And then we discuss the MCQ, we discuss each of the options and also the theory behind them. It is a great way of retrograde analysis, especially keeping in view the upcoming NEET PG examinations. And also, those of you who have just passed the first professional examination, be a great and interesting way to keep in touch with your subject. Okay, because reading the theory part again and again, especially when you have just finished reading it extensively for your professional examination, sometimes it can get drab. That is why the best way to stay in touch with the topic is to constantly quiz you about it. Okay, and Dr. Shivangi Shukla, as most of you have been together with me for the past 6 months, would know. I'll just quickly, till the others join in, I'll quickly brief you about the different types of NEET PG subscription that are available on the Unacademy app. Now, both Iconic as well as Plus subscriptions are available, and both of them will give you access to video lectures from top educators across the country, both live as well as recorded. The Iconic subscription will, in addition, give you access to resources from Prep Ladder. Okay, and yeah, and you will have access to live quizzes, all India level combats, their printed PDF notes, access to question banks containing more than 25,000 questions. Okay, all, and also the USP is that you can access all of these while on the go on any device of your choice, be it your phone, your laptop, your tablet, or even while sitting at home in the comfort of your home on your PC. So, a simulated physical classroom environment will be there at your comfort. This is the best. Also, Unacademy has come up with a rapid revision batch for NEET PG that is from March 16th to May 16th. Here, more than 40 educators will be taking video lectures to cover the entire syllabus, and there'll be 19 subject-wise tests and 8 grand tests for you to revise the entire syllabus. So, it will be a good decision to enroll in this. Also, do not forget to put in the educator code DRSHUKLA Dr. Shukla while taking any of these subscriptions, Plus or Iconic. This code is going to fetch you a discount of 10%. Okay, for either Plus or Iconic, you'll get a discount of 10% if you apply the educator code DRSHUKLA Dr. Okay. Now, so we have completed about, I think, 20 questions or not. Now, all are extensively covering different topics. This one also we did, this one also we did. Now, this is the question, the first question for tonight. What is the rationale behind adding sodium fluoride in blood collection tubes? A, to inhibit enolase. B, to inhibit glucokinase. C, to inhibit lactate dehydrogenase. Or D, to inhibit G6PD, glucose 6-phosphate dehydrogenase. Okay. Now your time to answer starts now. You have to answer in the comment section. All right. Okay. Start. Come on. Come on everyone, start answering. You have just 2 minutes to answer this, so come on, do it fast. This last 30 seconds left for you to answer. Come on. Everyone should answer this, okay? What is the rationale behind adding sodium fluoride in blood collection tube? Now, what type of blood collection tubes use sodium fluoride? Does anyone know? You can answer in the chat section. What type of blood collection tubes use sodium fluoride? Those that collect blood for glucose analysis, glucose estimation, isn't it? Blood glucose estimation. So why do they use now? Do you have an idea why they use sodium fluoride? Okay, so now the correct answer is to inhibit which enzyme? Which of these enzymes does it inhibit? It inhibits enolase. And what is the function of enolase? Enolase is the enzyme that enolase characterizes the conversion of 2-phosphoglycerate to phosphoenol pyruvate. Okay, so enolase is used in the synthesis of phosphoenol pyruvate in glycolysis. And what is used, which enzyme is used in the synthesis of phosphoenol pyruvate in gluconeogenesis? Now, if you say from phosphoglycerate to phosphoenol pyruvate, what is the enzyme involved? It is enolase. And this is in which type of reaction? This is in glycolysis. Now, if you consider gluconeogenesis, here the reactions are opposite of glycolysis. But since this is an irreversible step, so you cannot just go from here to here. Okay, this is not irreversible. This is reversible. Rather, phosphoenol pyruvate converting to pyruvate through pyruvate kinase. Now, this is an irreversible step. But pyruvate does not directly convert to phosphoenol pyruvate in gluconeogenesis. Pyruvate will first convert to oxaloacetate through pyruvate carboxylase enzyme, which utilizes biotin as the cofactor. And then this oxaloacetate will convert to phosphoenol pyruvate So can you see phosphoenol pyruvate is formed in glycolysis also? It is formed in gluconeogenesis also. Now this phosphoenol pyruvate can go on to form phosphoglycerate through enolase, but the enzyme involved here in the synthesis of phosphoenol pyruvate from oxaloacetate is phosphoenol pyruvate carboxykinase. Again, kinase means what is it requiring? It will require GTP. ATP or GTP, whatever you may, kinase will require energy and it is requiring GTP. Understanding? Got it? So what is the rationale behind adding sodium fluoride in blood collection tubes? It is to inhibit enolase. And what is the utility of inhibiting enolase? If you inhibit enolase, then glycolysis will also be through feedback inhibition. Glycolysis will be inhibited. Now RBCs that are present in blood, RBCs are enucleated. What are they? They are enucleated. Now can you tell me? Now are you getting the hint? If they're enucleated, that means the Krebs cycle cannot go through in RBCs. So what is happening in the RBCs? Only glycolysis is occurring. Okay, since only glycolysis is occurring, that means to prevent the uptake of sugar or of glucose by the RBCs, you have to prevent glycolysis. And to prevent glycolysis, what are you targeting? You are targeting enolase enzyme. Okay, that is why in the blood collection tubes you have sodium fluoride lined, so that the sodium fluoride can inhibit enolase of RBCs and RBCs do not use up the glucose present in the sample. Otherwise, if the RBCs use up the glucose present in the sample, then during the transit time when the sample has been collected until the time the sample has gone to the lab for detection, during that time only the blood sugar will be used up by the RBCs, the glucose level, and the glucose estimated, the glucose that is estimated in the lab will be falsely low. Got it? Therefore, what do? You add enolase to the blood collection tubes. Understood this? What is the function of glucokinase? Glucokinase is the hexokinase present in the liver. Glucokinase converts glucose to glucose 6-phosphate. Lactate dehydrogenase will convert pyruvate to lactate. G6PD is glucose 6-phosphate dehydrogenase. It converts glucose 6-phosphate to phosphogluconate, 6-phosphogluconate. Now if I ask you which of these is the odd one out here? If I ask you which enzyme is the odd one out, can you give me an example? Out of enolase, glucokinase, lactate dehydrogenase and glucose 6-phosphate dehydrogenase, can you give me the odd one out here? Anyone? Now out of these four, the odd one out here is glucose 6-phosphate dehydrogenase. And why is it so? Why is it the odd one out? Because it is utilized in, this enzyme is present where? It is present in the HMP shunt. Whereas all the rest of the three enzymes are used where? They are present in, all these three are present in glycolysis. Got it? Whereas glucose 6-phosphate dehydrogenase is present in the HMP shunt. Got it? Next one. In which of the following conditions will tyrosine behave as an essential amino acid? Is it A. phenylketonuria, B. alkaptonuria, C. homocystinuria, or D. tyrosinosis? Okay, your time to answer starts now. Come on. Come on, guys, do answer. All right. So the correct answer here is, in which of the following conditions will tyrosine behave as an essential amino acid? The correct answer is yes, it is phenyl ketone urea. And why is it so? Why is it so? Because, see, phenylalanine, which is an essential amino acid, converts to tyrosine using which enzyme? One enzyme and one cofactor. The enzyme is phenylalanine hydroxylase and the cofactor is tetrahydrobiopterin. Okay, so this phenylalanine will convert to tyrosine using phenylalanine hydroxylase in the presence of tetrahydrobiopterin. Now, if this phenylalanine hydroxylase is deficient, then there will be classical phenylketonuria, that is severe symptoms. Because phenylalanine hydroxylase is deficient, that means phenylalanine will not be converted to tyrosine, so tyrosine will be deficient. Tyrosine is deficient and phenylalanine is in excess. If this tetrahydrobiopterin is deficient, then there will be variant form of phenylketonuria. Now, this variant form of phenylketonuria has milder symptoms, similar symptoms: deficiency of tyrosine and excess of phenylalanine. Now, the excess of phenylalanine is going to be excreted in the urine as phenyl ketones. Now, the conversion of alanine to the conversion of alpha amino acid to alpha keto acid, that is reversible conversion of alpha amino acid to alpha keto acid, is known as transamination. So, alanine converts to pyruvate, okay, in transamination. Similarly, phenylalanine will convert to phenyl pyruvate. Got it? Phenylalanine will convert to phenyl pyruvate reversibly through transamination. Okay, understood this? Now, this phenyl pyruvate is a keto acid and it is excreted in the urine. That is why it is known as phenyl ketone urea. There are other keto acids also that are excreted in the urine, but this is the major one. Now, the excess of phenylalanine is going to crowd the large neutral amino acid transporter in the blood-brain barrier, and only phenylalanine is going to go through the blood-brain barrier into the brain. Whereas the other large neutral amino acids are going to be prevented from crossing the large neutral amino acid transporter through the large neutral amino acid transporter. Therefore, there will be deficiency of neurotransmitters, and there will be symptoms like cognitive delay, developmental delay, neurodegenerative symptoms, and ADHD, that is attention deficit hyperactivity disorder, and seizures. So these are the symptoms that will occur. And then deficiency of tyrosine is going to be manifested as deficiency of melanin, because tyrosine is needed in the formation of melanin. Now, when there will be no melanin, or there will be deficiency of melanin, there will be reduced or absent pigmentation of the skin and the hair. Understood this or not? Next, which of the following is the cofactor for phosphofructokinase? A. Manganese, B. Inorganic phosphate, C. Magnesium, or D. Fructose. Okay, the time to answer starts now. Come on. Okay, so last 30 seconds left now. What is the correct answer here? The correct answer is, because it is a kinase. That is what I stressed on. All kinases are transferases. And what do they transfer? They transfer phosphate group from one molecule to the other, or they can also cause substrate level phosphorylation, that is from scratch. But phosphate is not the cofactor here. The cofactor for most of the kinases is what? It is the magnesium ion. Okay, so the correct answer is magnesium. Okay, now what is cofactor? Now let us discuss what cofactor is. What is cofactor? Cofactor or coenzyme or prosthetic group, all these three are what? There is the similarity between these three. Now all these three are non-protein molecules which increase the catalytic efficiency of an enzyme. Got it? Now, what is the difference? Now, all these three are non-protein molecules which increase the catalytic efficiency of an enzyme. Then, what is the difference between them? The difference between them is that both cofactors and coenzymes are only transiently associated with the compound, with the enzyme. They are only transiently associated with the enzyme, whereas the prosthetic group is integrally attached to the enzyme. To remove the prosthetic group from the enzyme, to separate the prosthetic group from the enzyme, you have to denature the enzyme or break the enzyme. Okay? Whereas the cofactor and coenzyme can be easily removed from the enzyme. Then what is the difference between the cofactor and the coenzyme? Now again, cofactors are usually non-organic. They are usually metallic, inorganic. Whereas coenzymes are usually organic, like vitamins. Okay? Now, look at this. Apoenzyme plus coenzyme will lead to holoenzyme. So, the enzyme without the coenzyme or the cofactor is called apoenzyme. Once the coenzyme or the cofactor comes and sits on it, then it is called the holoenzyme. Got it? Understood? Next. And what is the function of phosphofructokinase? We already discussed in the last session. It converts fructose 6-phosphate to fructose 1,6-biphosphate. And where is this reaction, this step occurring? It is occurring in glycolysis. Phosphofructokinase. The fructose already has a phosphate group and then it is using kinase to add another one. Okay, next question. Which of the following is a primary bile acid? Which of the following is a primary bile acid? A. Lithocholic acid, B. Chenodeoxycholic acid, C. Deoxycholic acid, or D. All of the above. Okay, your time starts now. Come on, you have 2 minutes to answer in the comments section. Last few seconds left. Okay, so the correct answer here is primary bile acid. Okay, primary bile acid is which one? It is chenodeoxycholic acid. What is it? Chenodeoxycholic acid. Alright, now let us quickly discuss. Bile acids are formed from cholesterol. Okay, bile acids are formed from cholesterol in the small intestine. Now, what is the function of bile acids? Bile acids are used to emulsify fats. Bile acids are different from bile pigments. Bile pigments like bilirubin, biliverdin, they are formed from degradation of heme. Hemoglobin is degraded in the splenic sinusoids and the reticuloendothelial system into heme and globin. Then that heme is further broken down to produce biliverdin, which is converted to bilirubin. Okay, now that bilirubin is bile pigment. Okay, now those bile pigments, they are excreted in the intestine and in the urine. Alright, but what is bile acid? Bile acid is produced from cholesterol in the small intestine. How? First, the cholesterol is converted to 7-dehydrocholesterol, and this compound through conjugation, it is converted to cholic acid and chenodeoxycholic acid. Now they associate with glycine and taurine each. Both cholic acid and chenodeoxycholic acid will associate with glycine and taurine to produce what? The 4 primary bile acids. What are these 4 primary bile acids? The first one is glycocholic acid, that is glycine plus cholic acid. The second one is taurocholic acid, that is taurine plus cholic acid. The third one is glycochenodeoxycholic acid, that is glycine plus chenodeoxycholic acid. And the fourth one is taurochenodeoxycholic acid, that is taurine plus chenodeoxycholic acid. So these are the 4 primary bile acids. Now again they will be acted upon by the small intestinal bacteria through deconjugation to produce what? To produce secondary bile acids. Okay, whenever the primary compounds are acted upon by, they undergo some processing, then what do they form? They form secondary compounds. Now what will they form? They are going to form secondary bile acids. And what are these secondary bile acids? They are, first is lithocholic acid, and second is deoxycholic acid. Now out of these 6, cholic acid, taurocholic acid, glycocholic acid, taurocholic acid, glycochenodeoxycholic acid, taurochenodeoxycholic acid and deoxycholic acid, all these 5 undergo recycling through the enterohepatic circulation, whereas lithocholic acid is excreted. Okay, understood this? Very, very important. And what is emulsification of fats? See, fats are lipophilic or hydrophobic. That is, they cannot mix with water. But the whole of the digestive system has an aqueous environment. So all the enzymes, they work in the aqueous environment. And you have lipases and the other enzymes that digest fats are also present in the aqueous environment. Now for these enzymes to act upon fats, you need to have an interface that can allow their interaction. And that interface is produced through, it is achieved by the micelles. What are these micelles? They are produced by amphipathic lipids. What are amphipathic lipids? That have two phases. What are these two phases? Hydrophilic and hydrophobic phases. Now their hydrophobic phase, which is actually a lipophilic phase, that is the tail that faces the fat molecule like this. Okay, it encircles the amphipathic liquids, the amphipathic compounds. They encircle the lipid molecule around with which phase? With the hydrophobic phase. Okay, the tail. And their heads, which are hydrophilic, they face the outside aqueous environment of the digestive lumen. Now the enzymes, they can very easily act on this lipid molecule because there is no repulsion here because of the amphipathic phase of the lipids. Okay. Now these bile acids are also amphipathic and they form micelles around the fats to help them be digested. A common example of emulsification which we see in everyday life are the detergents. Okay, now there is the detergents, the detergent action. Detergents also are emulsifiers. The grease that is present on the clothes, that grease is also hydrophobic. So to help it be washed in the aqueous environment, the detergents form micelle around the grease and emulsify the grease so that the grease can be easily removed. Okay, understood. Hi Cheryl, hi Cheryl, Hitesh, hi Hobbies Nation. How are you? Are you following this? Now, I hope you guys have understood this. Let us conclude this session right now, and after a few minutes, we'll meet in the next session. Like the next session is also an MCQ based discussion session. We'll take a break for 5 minutes and then we'll resume the next session. Alright, if you guys have any doubt, you can ask me. The session is open for discussion for the next minute, and then we can conclude this session and we'll resume with the next one after a break of 5 minutes. Alright. I hope you have understood this concept of emulsification. You have understood the difference between bile acids and bile pigments because it is very, very important. And people tend to get confused between the two. So please make sure that you know there's a seed of difference between these two. Okay. Now I don't think I'm getting any queries here now. Alright then, I'll conclude this session. See you again after 5 minutes in the next session. If you haven't subscribed to this channel, then do subscribe to this channel for regular updates of my classes. And also go to the Unacademy app. There, go to the NEET PG section and look for Shivangi Shukla. And you can follow me there. Okay, for regular updates of my special classes on the Unacademy app as well. Okay guys, bye-bye. See you. Take a break, have some water, have some refreshments, and then join me again after 5 minutes on this channel itself on the next MCQ discussion session, that is number 8. For 8 session. Okay, alright, bye-bye.